carpal bone fracture, excluding carpal scaphoid or the navicular. Code 25630. Closed treatment of the carpal bone fracture, excluding carpal scaphoid, navicular, without manipulation, each bone. Or the 25635. Closed treatment of the carpal bone fracture, excluding carpal scaphoid, navicular, with manipulation, each bone. The physician performs the closed treatment of the fracture of the carpal bones, each bone. Triquetrum fractures are usually non-displaced and respond well to casting or splinting for 6 weeks. Capitate fractures are generally treated by conservative casting, immobilizing the wrist and thumb. Haymate fractures are accompanied by fractures at the base of the ulnar metacarpal and become asymptomatic after 4 to 6 weeks of immobilization. Lunate fractures are similarly treated by immobilization. Report 25630 if no manipulation is performed. Report 25635 if manipulation is reported for each bone. Coding tips. According to CPT guidelines, cast application or strapping, including removal, is only reported as a replacement procedure or when the cast application or strapping is an initial service performed without restorative treatment or procedure. In 25635, local anesthesia is included in the service. However, this procedure may be performed under general anesthesia depending upon the age and/or condition of the patient. Radiological services, see codes 73100 and 73115. For radiological services, add modifier 26 to identify the professional component unless a physician owns the equipment. For closed treatment of a navicular fracture, see code 25622 and 25624. Supplies when used providing this procedure are reported with A4580 and check with your payer to determine the coverage. Terms to know. Cast. Rigid encasement or dressing molded to the body from a substance that hardens upon drying to hold the body part immobile during the healing period. A model or reproduction made from the impression or the mold. Closed fracture. A break in the bone without a concomitant opening of the skin. A closed fracture is coded when the type of fracture is not specified. Closed reduction. Treatment of a fracture by manipulating it into proper alignment without opening the skin. A fracture. Break in the bone or cartilage. Immobilization. To prevent the body or a body part from being capable of moving by holding it stable manually with splints, casts, or strapping. Manipulation. Skillful treatment by hand to reduce fractures and dislocations or provide therapy through forceful, passive movement of a joint beyond its active limit of motion. Those are your codes 25630 and 25635.